afternoon, everyone. It's nice to see all the ladies and gentlemen here being able to participate in this virtual activity to basically have this privilege to learn more about the updates of COVID and how it impacts us, especially for the education sector. Now, before we start, I'd like to know if everyone can hear me, if I'm audible enough. Please type 1 if you can hear me well. Please type in the chat box 1 if you can hear me well. There you go. Thank you, Mr. Randy Cabao there. So a lot of you are able to hear me. That's nice. Now, before we start, of course, we'd like to ask grace from God. Let's have our opening prayer first. So let's recognize God's presence, as we say, in the name of the Father, the Son, the Holy Spirit. Amen. Father, thank you for every seat, though it's virtual, that has been filled here today. For each mind and heart that feels the presence of this room, we thank you. Only you truly know what we are setting out to accomplish today. We have an idea, a vision, hints, and daily instructions. We have talents, abilities, and time to work. However, only you can see in perfect detail the end of every beginning, every project, every season, every life. Nothing is ever in vain, for even mistakes and missteps are used for good. Your righteousness transcends all our efforts and understanding. Please forgive us for our pride, the pride that puffs us up, and the pride that threatens to unqualify us. Strengthen us, and may you be able to shower us with humility. Strengthen our confidence in who you have made us to be. Set us free from comparison in order to work together efficiently. Bless this activity today, all those present, as well as the lives of those who we will encounter afterward. Ready us to make every moment count. We ask this in Jesus' name. Amen. Holy Mary, hope and seat of wisdom, pray for us. In the Father, the Son, the Holy Spirit. Amen. Once again, ladies and gentlemen, good afternoon. I hope you're having a good day. So just out of curiosity, please type where you are basically attending this webinar right now. So please type in the chat box the place where you are listening this particular webinar right now. Right, so we have there from Southdale, at home, sick at home, in the clinic, at home. I can see also teachers in Springdale there in one venue. For the others also, you can please open your camera so that we can also be able to see each other. In a sense, we are still virtually connected. All right. So good afternoon to parents, teachers, students in Springdale, Southcrest, Southdale, and as well as our visitors, our guests, and everyone who's attending today. We are very fortunate to have a very special speaker today. Last March 2020, our lives changed. We were able to change our routines, change everything, especially in the education sector. In our workplace and even in our personal lives have been affected by COVID-19. And now that we see practically a small light from all those work overload, basically because of work from home, and also during the lockdown, we're able to be back together physically, and for possible and for next year, we have a hybrid setup, which means the face-to-face, physical, and online face-to-face classes as well. Now, if you have questions for our speaker today, you can freely type it in the chat box just in case you forgot about it. We also receive questions in the registration, so we'll also bring that up at the end of the talk. And after the talk also, we'll open the Zoom, so you can be able to turn on your microphone and your camera and raise your hand if you have a live question. All right. So I guess we are pretty much excited, and we are also very, very fortunate to have our speaker today. So let me introduce the speaker for everyone. So our speaker today is the chairman of the Prevention and Control of Infection Committee. She is practically an expert of our topic today. She is a chairman at Chonghua Hospital, Cebu, and she was also a BS Biology degree holder from University of the Philippines on 1990 to 1994. And also, she is in Cebu Institute of Medicine on 1994 to 1998, and as well as Chonghua Hospital in Internal Medicine on 1999 to 2000. She was also in the University of the Philippines, Philippine General Hospital from 2000 to 2002, and has a fellowship in infectious diseases. She was also in Weill Cornell University in New York, 2002, with a fellowship in HIV and a section head of the Adult Infectious Diseases in Chonghua Hospital, Cebu. All right, so ladies and gentlemen, with a virtual clap and basically a virtual welcome, let us all welcome to our virtual stage, Dr. Arlene G. Macabaya.
Good afternoon, everyone. Thank you for that kind introduction. So without any delay, let's start with the lecture. Can we flash the first slide, sir? Okay, so this is just an update. As you very well know, this disease has been with us for 2 years, but data has been changing every month or two. So this is what we know as of the moment. So next slide, please. COVID-19, a respiratory disease caused by SARS-CoV-2, discovered in 2019, that spread through respiratory droplets when an infected person coughs, sneezes, or talks. So that's the main mode of transmission. Some may not have symptoms, others may have mild symptoms, but our elderly patients and those with underlying medical conditions are at higher risk for severe illness. In children, rarely, there may be what we call Miss-C. What is Miss-C? Next slide. Next slide, sir. Okay, it's a multi-system inflammatory syndrome in children. Actually, also there's also an equivalent among adults. So it's an inflammation of the different parts of the body: heart, lungs, kidneys, brain, skin, eyes, or gastrointestinal organs. The cause is unknown. However, patients who were diagnosed with Miss-C had the virus or had been around someone with COVID-19. And this can be serious, even deadly, but most children who were diagnosed with this condition have gotten better with medical care. And vaccination has been shown to decrease the incidence. So it's not just a simple cough and a cold. There may be rare complications also. Next slide. So let's go to the variants. As you very well know, COVID has been evolving from the original Alpha or the Wuhan strain. It evolved into the Beta, the Gamma, the Delta, and what is predominantly causing all the COVID cases all over the world is the Omicron. It started with BA1, BA2 last December and January, and what is causing the outbreak in other parts of the world is the BA4 and BA5 strains. Next slide. So that's why I'd like to emphasize the different strains, because different strains of COVID have different rates of contagiousness. So how do we define contagiousness? It's we call R naught, or the number of people that one infected person will pass on a virus to on average. So prior to COVID, the most infectious disease that was known was measles. So for each measles case, they could infect 18 other people. So the 1918 flu pandemic and Ebola virus, the R naught was only 3, mumps is 12. But as you can see from the original Wuhan strain, which had an R naught of 3, the Delta became 5, the Omicron became 9.5. But the latest Omicron subvariants, which are causing the outbreak all over the world, it has gone up to 18. Next slide. Next slide, please. Okay, so do we have BA4, BA5 in the Philippines? Yes, we do have BA5. So from July 7 to July 11, 79 new cases of Omicron subvariants were detected, and majority were the BA5. There was a few cases of BA2, BA4, and as I have already mentioned, the BA5 is the one that is most infectious. We don't know in the next few months if another strain will be able to overtake it. I cannot answer that as of the moment. We just have to wait and see and protect ourselves. Okay, next slide. So how about children and the role of schools? Children and COVID-19, the last available scientific evidence has shown that children do not play a more significant role in COVID-19 transmission than adults. However, they tend to be asymptomatic or develop only mild infection. which makes it harder to detect or diagnose. At present, it remains unclear how infectious asymptomatic children are. Next slide. So, schools are an essential part of society and children's lives. Closing schools should always be a last resort in efforts to control the pandemic. So, if proper and consistent measures are in place, schools do not pose a greater risk of infection for children than any other public place and are unlikely to drive transmission of the virus. Next slide. So, how do we make schools safer? So, these are the general principles: ensuring proper and feasible physical distancing. So, for the WHO and the DOH, that's 3 feet. But if we go with the US CDC, that's 6 feet. So, it depends on where you're coming from. So, we need adequate ventilation and cleaning, practicing hand hygiene and cough etiquette, and using personal protection, such as face masks, will not only minimize transmission of COVID-19, but also other respiratory infections at schools during the autumn or winter season. So for us, that would be the rainy season. We need to reopen schools as soon as possible to guarantee a suitable learning environment and lessen the unintended negative social effects of school closure. Next slide. So for this particular lecture, I opted to choose only 4 references in general because this will lessen confusion. So if there is a guideline from the Department of Health, that's what I primarily use. But others, I use the World Health Organization, the US Centers for Disease Control, and the European Centers for Disease Control. So this will avoid confusion. Okay, next slide. So there are essentially 6 ways to or preventive measures for COVID. Number 1 is staying up to date on vaccinations. Next slide. So I will use the Department of Health for this particular recommendation because different countries have different recommendations. So it will be quite difficult to compare different countries. Okay. So for 5 to 11 years old, is the Pfizer COVID vaccine, the primary series only, 2 doses with the second dose given after 21 days. But for the 12 to 17 years old, it's also the Pfizer vaccine with 2 doses given 21 days apart. And the booster dose, so please remember for 12 to 17, a booster dose is now recommended. 1 booster dose given at least 28 days after the second dose of the primary series. There has been talk of a vaccine for children less than 5 years old, but this is not yet available in the Philippines. Next slide. So what are the common side effects? Pain at injection site, fever, and body pain. These are mostly mild, tolerable, and self-limiting. They resolve after a few days. Now, I think somebody will ask, next slide, because it has been well publicized, myocarditis or inflammation of the heart using the mRNA or the Pfizer or Moderna vaccines. This is especially seen in male adolescents and young adolescents. However, according to the US CDC, there are only 11 documented cases. So please take note of that. There are only 11 documented cases. They are more often after the second dose and usually within a week of vaccination. Most patients with myocarditis or pericarditis who received care responded well to medicine and rest and felt better quickly. Patients can usually return to their normal daily activities after their symptoms improve. Next slide. But this is something that you should watch out for, okay? So both myocarditis and pericarditis have the following symptoms: chest pain, shortness of breath, feelings of having a fast beating, fluttering, or pounding heart. So you have to seek medical care if you or your child have any of the specific or general symptoms of myocarditis or pericarditis, especially if it's within a week after COVID vaccination. Next slide. Okay, so coming soon, there's going to be a vaccine a bivalent vaccine, or meaning a vaccine that contains the original strain and the Omicron variant. But please bear in mind that this was developed during the BA1 and BA2 time, so meaning last December. Okay, so what is going around is the BA4 and the BA5, so I don't know what the effect will be. However, what we have seen is that with the current vaccines available in the country that have no Omicron coverage, they are still shown to decrease the severity of symptoms should you get infected with the virus. Okay, it does not guarantee that you will not get the virus, but at least it's just the common cold. It's just going to be a little sore throat, a little cough, a little cold. We will so far, based on what I have seen here in Cebu City, most of the patients who have been vaccinated and boosted, I have yet to see a patient who went on to die, okay, from the COVID infection. So far, I don't know in the next few weeks, but so far, okay. Next slide. Okay, this is the most awaited part of the lecture. That's what I see, the most common question, ventilation systems. Okay, next slide. So according to the World Health Organization, good ventilation is defined as opening a window. It is better when you open windows or doors on opposite sides of the room to create a cross breeze. However, if you only have one window, they strongly suggest that you put a pedestal fan in front of the window facing the outside so that the air inside the room will go outside, and it's the sunlight, the UV rays of the sunlight, that will kill whatever virus or bacteria that's there coming from your area. However, when it's too hot or too cold to leave windows open, we ideally should open windows for a few minutes each hour to bring in fresh air. Next slide. So when using a fan, always open windows and doors when using a fan. Running a fan in a closed space can increase the spread of the virus because the virus is not able to go out. So it's just going around the room. So when using an air conditioner, which is a wall or a window type, we open windows for a few minutes every hour. Most wall and window air conditioners increase the spread of the virus by recirculating indoor air. So open it every few minutes. However, when we are using a centralized air conditioner or an HVAC or a type of system where it can also control ventilation, we use settings that increase the amount of outdoor air pulled into the system. Make sure the system is regularly inspected, maintained, and cleaned. So when we are using an air filters do not replace ventilation, but they can help reduce the possibility of transmission. So we still need to continue to open windows for a few minutes every hour to bring in fresh air. Okay, so I think most of us have HEPA filters at home. How about when using air conditioning in a vehicle? We use the setting that brings in fresh air so that I think you can see that in your car. We use the one with the arrow going inside the car, not the one that's making a U-turn. So that means fresh air is coming in regularly. Next slide. Okay, so in public spaces where we are not sure about the ventilation, we maintain social distancing, as I have mentioned, for the WHO and the Department of Health. That's 3 feet. For the US CDC, that's 6 feet. We try to use a lot of our alcohol. And then respiratory etiquette. That means when we are coughing or sneezing, we use a tissue and throw away the tissue. Or if we don't have a tissue, we sneeze or cough into our sleeve. We use a mask as much as possible. We open windows as much as possible and get vaccinated as soon as it is your turn. Next slide. Okay, I think I mentioned this. What's the difference between an HVAC and an air conditioning unit? An HVAC has heating, ventilation, and air conditioning. So it is responsible for heating and cooling the air in your building and provide ventilation to allow moisture to escape. It includes the furnace, the air conditioning unit, and any ducts or ventwork designed to release moisture. While the conditioning unit is just designed to cool the air in your home. So what's the difference between an HVAC and an air conditioning unit? The system designed to cool the air is the air conditioning unit, while the system designed to heat the air and push moisture out through the vents is the HVAC unit. So I think most of us only have an air conditioning unit. So you might want to check what you have at home or in the school. Next slide. So will an air conditioner provide good ventilation? Majority of wall or window unit air conditioning systems unfortunately do not provide ventilation. They just reduce the temperature and humidity of the air by recirculating indoor air. So ideally, we need to open windows for a few minutes every hour to bring in fresh air from the house, while the HVAC will pull out outside air inside. Okay, so this will change the air every hour. So ideally, it's an HVAC. However, you need to clean it regularly according to the manufacturer's recommendations. Next slide. So do portable air filters provide ventilation? No, they don't provide ventilation and do not replace other ventilation methods. However, they can help to reduce the concentration of the COVID-19 virus in the air, thus reducing the possibility of transmission. So for those with HVAC units, a MERV 14 ISO EPM1 can filter 70 to 80% of the air quality when used in indoor settings. So I'm not very sure anymore about this MERV 14. This is something very technical to me already. So if you have questions on this, maybe we can direct it to the engineers who are present in this meeting. Next slide. So in schools, we need to improve the level of air filtration as much as possible. Make sure the filters are sized, installed, and replaced according to the manufacturer's instructions. We consider portable air cleaners that use high efficiency particulate air or HEPA filters to enhance air cleaning wherever possible, especially in higher risk areas such as a nurse's office or sick or isolation room. We can consider using ultraviolet germicidal irradiation or UVGI in schools and non-home-based childcare programs as a supplemental treatment to inactivate the virus. Next slide. So what is a UVGI? Next slide. Right, sorry. So I found these are not from the US CDC, the European CDC, or the Department of Health, but I found this from the United States Environmental Protection Agency. It's a manual for indoor air quality tools for schools. So maybe Springdale and Southcrest can take a look at this document. It's quite technical and I think needs an engineer to help you interpret this. There's also another document, next slide, from the Harvard T.H. Chan School of Public Health. Again, it talks about how school buildings can be improved. It talks about CO2 levels in the room. So I'm not very familiar with that anymore. But I hope the schools can take a look at these documents and maybe help decide. This can help them decide whether we can continue to use air conditioners for our children or not. Next slide. So I've mentioned already the ultraviolet germicidal irradiation. It's the use of ultraviolet energy to kill viral, bacterial and fungal organisms using the UVC energy. So upper room UVGI refers to a disinfection zone of UV energy that is located above people in the rooms they occupy. So as you can see in the drawing, it's above you. Okay, this kills airborne pathogens in the room where they are released. Fixtures are installed to prevent direct UV exposures to people in the room. That's why it's above the level of the tallest person. Next slide. So I think I've mentioned this is just an illustration of how it is how UVGI works. So whenever the virus particles are flying up into the air, that's where your UVGI device will kill them. Next slide. However, we have to remember that if your ventilation is quite good, the UVGI will not add anything. Okay, it would not add as much benefit. Okay, and can get quite expensive. Next slide. So we used exhaust fans in restrooms and kitchens. We inspect and maintain exhaust ventilation systems in restrooms and kitchens. We ensure restroom and kitchen exhaust fans are on and operating at full capacity while the school or childcare program is occupied, and for 2 hours afterwards. You want to continue pulling out the air inside the room. Next slide. We open windows in transportation vehicles. So these are for the children. Well, we don't have school buses, but I do know of some children that have carpooling. So ventilation is important in buses and vans, servicing schools and childcare programs, along with other strategies such as mask use for people over 2 years old and physical distancing. We keep vehicles open when it does not create a safety or health hazard. Next slide. At home, I found this interesting tool that you can use. Whatever is the system, the ventilation system that you use in your home, you can look for this in the US CDC website. Okay, how can I decrease the level of virus particles during and after a guest visits my home? Okay, next slide. Okay, so if you don't open any window, the air conditioning is on, you don't have an HVAC, you don't have a portable HEPA filter, you don't do extra hour of ventilation, meaning you don't open a window or door after a guest visits. As you can see, practically 0% particle reduction achieved in your home. And 1 hour later, practically also no decrease in particle. Okay. Oh, I'm sorry. You just did 1 extra hour of ventilation. Okay. Next slide. Okay. So if you just open a window during the visit and you didn't even do an extra hour of ventilation, you have no portable HEPA filter. At the end of the 4-hour visit, there's a 29% reduction achieved in your home by using ventilation. Okay. By just opening the window. 1 hour later, it's quite the same, 29%. Next slide. However, if you use a portable HEPA filter, you do an extra hour of ventilation after the guest leaves, and then you open a window during the visit, there's an 83% particle reduction achieved in your home by using ventilation. 1 hour later, it's the same. Next slide. So if we open the window, have a HEPA filter, extra hour of ventilation, 83% reduction, 98% reduction after 1 hour. Next slide. If you have an HVAC that's on, meaning then you've turned on the ventilation, and you put also the premium filter for an HVAC system. You put a portable HEPA filter, you open your window, there's an extra hour of ventilation. At the end of a 4-hour visit, there's a 93% particle reduction achieved in your home by using ventilation. And then after the 1 hour or extra hour of ventilation, more than 99% particle reduction. Okay, I found this quite useful. Okay, So you can find it in the US CDC website. Next slide. So the next preventive measure is staying home when sick. Next slide. People with symptoms of infectious diseases such as fever, cough, colds, diarrhea should stay home and get tested for COVID-19 or for other infectious diseases. High-risk individuals with COVID-19 should immediately consult a physician for possible treatment, even if their symptoms are mild, because they are the ones at highest risk for going on into a severe infection. Staying home when sick can lower the risk of spreading infectious diseases. Next slide. I think there was a question submitted earlier. When is COVID most infectious? COVID is said to be most infectious at least 24 hours to 48 hours after the start of symptoms. Next slide, hand hygiene and respiratory etiquette. So washing hands can prevent the spread of infectious diseases and not just COVID-19. So we need to teach our children proper hand washing. We monitor and reinforce hand washing, especially during key times of the day, before and after eating and after recess. We provide adequate hand washing supplies, including soap and water, hand sanitizer. Hand sanitizers should be stored up, away, and out of sight of younger children and should be used only with adult supervision for children ages 5 years and younger. Next slide. What is respiratory etiquette? So that means, I think I've mentioned this earlier, we use a tissue when we cough or sneeze and throw it into the garbage can. Or we can cough or sneeze into our upper sleeve and not in your hands. And then we wash our hands after we cough or sneeze so that we remove the virus or bacteria that's in our hands, or we can use hand sanitizers. Next slide. So cleaning and disinfection. Next slide. We clean surfaces at least once a day to reduce the risk of germ spreading by touching surfaces using alcohol or other disinfectants. If the facility has had a sick person or someone who tested positive for COVID-19 within the last 24 hours, the space should be cleaned and disinfected. Next slide. Recommended disinfectant solutions are 70% ethyl alcohol to disinfect small areas and sodium hypochlorite or bleach solution at 0.5% for disinfecting surfaces. Next slide. For soft surfaces such as carpeted floor, rugs, and drapes, we clean the surface using soap and water or with cleaners appropriate for use on these surfaces at least weekly. We launder items according to the manufacturer's instructions, and we use the warmest appropriate water setting and dry items completely, or disinfect with an FDA-registered household disinfectant. For electronics, such as tablets, touchscreens, keyboards, remote controls, and ATM machines, we consider putting a wipeable cover on our electronics. We follow manufacturer's instruction for cleaning and disinfecting, and if no guidance, use alcohol-based wipes or solutions containing at least 70% alcohol. Next slide. So other minimum health protocols. Next slide. So as I keep on mentioning, the WHO and DOH define social distancing as 1 meter or 3 feet apart, while the US CDC considers it 6 feet. Next slide. The school shall ensure that each learner, teacher, and personnel have access to surgical face masks. If a cloth mask shall be used, it should be made of breathable materials with at least 2 layers of cotton or non-woven nylon with aluminum nose bridge. It could also be partnered with a surgical or medical grade mask underneath. Surgical masks shall be stored in the school clinic and shall be available at the school entrances. These shall be reserved for symptomatic individuals, healthcare providers, and learners who come to school without face masks. Next slide. Children aged 5 years and under do not need to wear a mask. They may not be able to properly wear a mask without proper supervision. In areas where SARS-CoV-2 is spreading, children ages 6 to 11 years are recommended to wear a well-fitted mask in indoor settings with poor ventilation or if social distancing cannot be maintained. Slide. Adolescents 12 years or older should follow the same WHO recommendations or DOH recommendations for mask use as adults. As much as possible, it is important that children of all ages keep their hands clean when putting on and taking off their mask. Next slide. A well-fitted mask that covers the nose and mouth should be worn in settings where SARS-CoV-2 is spreading, regardless of vaccination status or history of prior infection, when interacting with individuals who are not members of their household. When indoor settings where ventilation is known to be poor or cannot be assessed or the ventilation system is not properly maintained, regardless of whether physical distancing of at least 1 meter can be maintained. In indoor settings that have adequate ventilation, a physical distancing of at least 1 meter cannot be maintained. In outdoor settings where physical distancing of at least 1 meter cannot be maintained. Next slide. So this was also a question thrown in. Can people wear masks while exercising? People should not wear masks when exercising as much as possible, as masks may reduce the ability to breathe comfortably. Sweat can make the mask become wet more quickly, which makes it difficult to breathe and promotes the growth of microorganisms. The important preventive measure during exercise is to maintain physical distance of at least 1 meter from others. Next slide. I think that's my last slide. I hope I've answered all your questions, but if you have other questions, I will try to answer to the best of my abilities. Thank you.
Thank you very much, Dr. Macabaya. So if you have any questions, please feel free to chat in the chat box or raise your hand. For the meantime, while we are waiting for your questions, we also have some questions in the registration who probably might not have been answered yet. Maybe let's start with number one, this one. So there's a question regarding COVID kits being reliable. So
okay. We have to remember COVID kits will never be as good as your PCR. But studies have shown that if there is an outbreak going on and the patient is symptomatic, then it can be as reliable as 90%. But it should never be used for screening for patients or persons with no symptoms, because the ability to pick up COVID can drop to as low as 60%. So it is best used in an outbreak setting with persons having symptoms.
Great, thank you very much, Doc. So we have a question from the chat box, since you mentioned we should not wear masks during exercises. So there's a question if we do not wear masks during PE classes.
As the WHO has said, when you sweat, it's going to make the mask wet and make it more difficult to breathe. So as the WHO has said, maintaining physical distancing during physical exertion is the best way to prevent the spread of the virus.
All right, thank you. There's another one. What are your thoughts on, since not every student might have been vaccinated, especially the kids, what are your thoughts on vaccination not being mandatory?
Okay. It's a very political question and very difficult to answer. Well, we cannot really force everyone, okay, if they don't want to be vaccinated. I guess it is to each his own already, and you'll just have to protect yourself. And then the best way to protect yourself will be to get yourself vaccinated and put your masks on and do all those other measures. So we will just have to, if you don't feel there's a need for you to get vaccinated, or for some other personal reason you don't want to get vaccinated, then you will just have to bear the risk of going on to developing the severe form of the disease.
Right. Thank you very much, Doc. All right. So there's also a question regarding masks. So since pretty much access to masks is everywhere, and there are affordable masks, N95 and KN95, would that be enough, Doc?
Okay. Well, that's why actually, if most of the people are vaccinated, their ability to infect others is actually also lower because the viral load is also lower. So if a person is infected and wears a mask, then it decreases the chance of him passing it on. So if you're also wearing a mask, then it also decreases the your probability of getting the disease. And if you have good ventilation in where you are staying, and then you maintain social distancing, it's practically unmeasurable, your probability of getting it. So it's not just the mask per se, but all the preventive measures taken together.
Right. But it's also, it's more helpful rather compared to not wearing anything at all.
Yes, it's not the end all and be all of the preventive measures. It's a combination of all the other preventive measures taken together.
All right.
Vaccination, ventilation, wearing a mask, that's needed. Okay.
All right. So we have a lot of questions and vaccines in those who sent in the registration, but we also have one here. So especially since we have young kids, what are your thoughts on mRNA vaccines?
As I have mentioned, that's why I put in a slide on myocarditis, pericarditis, because that's the feared complication. As I have mentioned, the US CDC has only 11 documented cases. So it's not that common. And actually, they did a study among the US soldiers who were vaccinated, and the incidence of developing myocarditis, pericarditis was less than 1%.
Okay.
It's actually quite rare and very difficult. So as a parent, you have to just balance what are acceptable risks for you. Okay? So if it's an acceptable risk for you that your son or daughter will develop myocarditis, pericarditis, the probability is less than 1%. While if you develop COVID, you may have all these other complications. So it's a matter of personal choice already for me.
Yeah. But looking outside, it's generally, it outweighs the 1% probability.
Less than 1%. Let's put it there. Less than 1%.
Even less. All right. So there are actually questions here regarding what the school's plans are. I think we can address that to Southcrest and Springdale, especially from the inputs given by our speaker today. So for sure, there were trial run being implemented prior to the school year, and plans probably would develop from this. So there's a question regarding if there are recorded cases of MIS-C in children in the Philippines specifically.
Yes, there is. There are. Unfortunately, I cannot give you data from the Philippines because there has been no published data that really tells us the incidents in the Philippines. But yes, my colleagues have admitted, my pedia infectious disease colleagues have mentioned that they do have MIS-C cases in Cebu. Okay. And as I have mentioned, it happens in usually in those who are unvaccinated and those who have been around adults who had COVID, or they also had COVID symptoms prior to developing the inflammation. Now that's why it's multi-system inflammatory syndrome, because it's not, how would you say that? There's no definite thing for it. Sometimes the patient will present with inflammation of the gastrointestinal tract. So they have diarrhea, they have inflammation of the heart, it can be an inflammation of anything, any body part. Okay. It's quite rare, but of course, we infectious disease doctors see it because they are referred to us. And there are only about 5 pedia infectious diseases in Cebu. And there are only 12 adult infectious disease specialists in Cebu. So we get to talk about this. But I don't want to say that it is very common. For us, it's common because we are the only ones who see them.
Yeah.
Okay.
Is there data on the brain fog among the MIS-C patients as well, Doc?
I'm sorry, again?
There's a question here. Is there any data on brain fog among MIS
Okay.
patients?
Actually, it's quite rare. So brain fog is actually not even, I think brain fog, it falls more in the category of the long COVID, meaning the complications after a COVID infection, which is not just seen in children, but is also seen in adults. Long COVID, it's also evolving, the definitions. It's very difficult also to estimates anywhere. Even there are no, how would you say that, statistics on it. Okay, because number one, it's very difficult to define. How will you define brain fog? You have every one of the COVID patients have an EEG, a CT scan, an MRI. So that's why it's very difficult to define, difficult to quantitate, because it's also difficult. It's difficult to define.
Yeah, exactly.
Okay.
I also have like a question myself. So I read somewhere, I'm not sure particularly where, but that you mentioned about the R0 for the latest subvariants of COVID is 18. Is it specifically for the BA5, Doc? 4 and 5?
Yeah, BA4 and BA5. It's now up to 18.
So I read somewhere that when you're infected with a BA5, it's possible for you to get reinfected as soon as possible. Like
okay. Sige. It's possible for you to get reinfected if you've had the alpha or the beta or the other previous strains. But for the Omicron, it has not been defined yet, because you have to remember Omicron BA1 only came out last December. Okay. BA4 only came out 2 months ago. So I cannot answer that. But what I can say is that if you've had alpha, if you've had delta, the other previous strains, yes, you can get Omicron. But whether getting Omicron BA1 and then you're going to get BA4, BA5, it's something that I cannot answer.
Okay, great. For the others, you can actually raise your hand if you want to interact yourself with our speaker this afternoon. There are 2 questions I have in the chat box. I'll read it myself. So, is it true that antigen test kits can possibly detect some other viruses? So, if it comes out as positive, it's not 100% COVID. It's not?
No. Okay. When you manufacture an antigen kit, that it is specific for that particular organism. I think the person is asking about a false positive, false negative.
Yes.
Okay. Test kits are very specific for that particular organism that is being tested by that kit. So if, let's say, for example, you have the flu, and I have seen patients where they do have the flu, so they also have the same symptoms, fever, cough, colds. But when you test them, they're COVID negative. But when you do the other tests for flu, they do come back positive. So no, it does not. The antigen kits, the COVID antigen kits will not detect the flu. Okay? So please bear in mind, there are also other strains of coronavirus, and not just COVID-19, which used to cause the most, which used to be the most common cause of the cough and the cold. There are other coronavirus strains. So you may have a coronavirus infection, but not necessarily COVID-19.
Right.
So there's the rhinovirus, there's the enterovirus. There are a lot, actually.
That's right. So there are questions a lot on ventilation. I believe these are already answered a while ago. So we have this question: would it be better to turn on UV lights and air ionization while people are around, only when the room is empty, or only when the room is empty, as long as there's good ventilation?
Okay. UV lights, I think you have to make sure that no one is around. Okay. The UVGI that I was mentioning was the UVGI where you put the UV rays above the level of people. So the air that's going up, that's the one that it is clean. Okay. And it does not hit the people inside the room because it's above the level of the tallest person.
Right. So this is a question I guess for everyone to know. So so if you basically have a possible COVID positive person who is pretty much asymptomatic, how long should the person be isolating, and how soon does he or she has to swab test again to be in the clinic?
There are different answers for that. It depends on what country you are in. Okay, so if we're talking about the Philippines, because it can get quite expensive to have all these tests done, the recommended isolation is 7 days for mild and asymptomatic cases. So if you needed oxygen, you needed to be hospitalized, it's at least 10 days. But if you're what they call immunocompromised, meaning you're taking steroids, you're on dialysis and others, that may be as long as 21 days. But if you're going to the US, they also have a different calculator as to when they allow, it's different for each country. It's also different in Singapore. And in Switzerland right now, if you're asymptomatic and positive, they don't even let you do isolation anymore. You're just told to wear a mask and you can go to work. So I don't want to go into the different countries and their policies. Let's just stick to the Philippine guidelines. But what I'd like you to remember is that majority of patients are already non-infectious by the 5th day. So it was just set to 7 days so that, this is for mild and asymptomatic cases. Okay? It was just set to 7 days just to be on the safe side. But majority are already non-infectious by the 5th day, where day 0 is the first day of illness, and then 1, 2, 3, 4, 5, because that causes quite a lot of confusion.
How about for asymptomatic, doc? What would day 0 be?
The day of the test swab.
All right. Okay. So so there are actually a lot of questions as well asking for plans of schools, basically the ventilation. I guess the things that we had learned today would be good inputs to have practices, especially for air conditioning. So we can explore that and what possible preferences of the parents are. Now, since there's so much we can do, the parents can do in allowing their students to go to school, and hopefully they won't get transmitted. As parents, since they have no control in the ventilation of whatever happens, what's the best thing they could do to prepare their kid from getting infected by the COVID?
I think the best slide will be the one from the World Health Organization. I think I showed that slide, the general principles of ventilation. Open windows as much as possible, 2 windows across each other. So there's cross breeze, or if you only have 1 window, put an electric fan in front of that window or door so that the air from your room will go outside and then it's the UV rays of the sunlight that will kill already the virus or what other bacteria that's there in your room. Wear masks, social distancing, so the whole package. It's not just one, it's a combination.
So I guess possibly the last question, if there's no one who will send their questions anymore. There's one more question. Will there be a possible um, lockdown in case BA5 spreads?
That I cannot answer. It's the government that will decide. But I think we're moving into the phase where we just have to live with the virus, protect ourselves.
Mhm.
I don't think they're going in that direction, doing lockdowns again, considering that they've made the vaccines quite available. The government has put out a lot of guidelines to help you get yourself protected. I sincerely doubt we're going to have another lockdown.
Right. So I guess we've reached the end of the rope for our open forum. Thank you very much, dear guest, and also to our speakers. Now, before we end, we would like to extend our greatest gratitude to you, Doc, for basically giving us the knowledge on COVID. And it's pretty much very helpful for us as we transition to our classes weeks from now, as parents, as teachers, as school managers, and as well as for those who are here as students, you'll be able to know how to maneuver over the school year. Now, before we end, we would like to virtually present this certificate to you, Doc. So this certificate of recognition, we virtually award it to you, Dr. Arlene Macabaya, for sharing your time and your expertise as a resource speaker in our get-together today, all about COVID-19 prevention at home and in school, which is participated by the PAREF community in Cebu via Zoom. Given today, the 22nd day of July 2022, signed by Dr. Nancy C. Payad, the Executive Director for PAREF Springdale, Ms. Emilu C. Visaya, the Executive Director for Southcrest, and Mrs. Stella E. Gonzalez, the Executive Director for Southdale. All right, so thank you very much. We will also send you a token. We shall send it to you over your home or wherever it's most convenient to you. Thank you very much, Doc Arlene, and to all who are here. We also extend our gratitude. Thank you very much for coming. I hope everything that we learned today will be put into good use. And I guess that is the end of our get-together this afternoon. That would be all. Thank you, and please have a good day.